Hello and welcome to week 11. We're covering conflict management this week. And so, since you guys are still doing your presentations, we're just going to run this as an asynchronous recorded session. However, if you are wondering about the material and you want to ask questions, just feel free to email me with your questions. And then, of course, follow the learning objectives as well for your readings to ensure that you guys are prepared for the final exam. And so last week I posted for week 10 as well. So this is just a quick recap of some of the items that I mentioned for you guys to look into. So we covered group dynamics. So we looked at teams and what actually makes effective teams. We have highlighted team steps quite a bit over the last couple of weeks. So hopefully you guys are comfortable with that now. I can see from also your presentations that you guys are getting really comfortable with things like SBAR and a lot of more deeper understanding of these topics, which is really great. Okay, and then so your learning objectives, so matching with your addendum. So conflict is the main topic for today. And so this will include situations in which what we call horizontal violence. So you may encounter this, unfortunately, in your clinical practice, even as students. And then we'll talk about things like de-escalating violence, and I'll give you some examples from my own practice and then some videos to show you what this might actually look like in the real world. So when we're thinking about conflict, what we should really be thinking about is that there is a difference of values or goals or needs, and this is basically clashing and creating tension among either individuals or groups of people. And unfortunately, this is inevitable in healthcare due to the complexity of our work environment, as well as the stress that is involved in our jobs. Also, you're working with many different people with different personalities, different traits, different perspectives, and so you have to think about, what happens when all of these people are having to work together. So different types. So we think of intrapersonal. So that would be within yourself. So if you're having your own conflict, and then versus interpersonal. So that's between people and teams, which is mostly what we will focus on today. When we hear the word conflict, I think we all inherently just assume this is something negative, but it doesn't have to be. So conflict in and of itself isn't really a huge problem. What is the problem is how it is managed, and really that is going to determine also its outcome. And again, whether it's negative or positive. I mean, you can think about this in your personal relationships as well, because we all have relationships with people, family and friends and so forth, and we do find that conflict is inevitable, right? So again, it's not the conflict in and of itself, but how you actually manage that within your circles. And so if you want to think about a functional or more positive conflict, the idea here is that it can be resolved in a way that there is actually some positive outcome rather than a breakdown in communication. Okay, so that would be dysfunctional. Okay, so maybe people are not expressing their feelings or other negative type of behaviors. So if you want a more clinical example, you can think about perhaps if the nurse is trying to keep a patient from going home. So maybe the patient is post-op and they are supposed to be discharged, but the nurse feels that the person is not ready for discharge. Maybe there's uncontrolled pain or something like that. And then the conflict is that the doctor is insisting, the patient actually does need to be discharged and would like to proceed. So if the nurse is able to speak up and demonstrate their point and advocate for the patient in an assertive manner, they will potentially have a good outcome for the patient, right? So in this sense, yes, there's a conflict, but if it can be resolved in such a way that communication was effective, and then the doctor will say, okay, you know what, that's a good point. I will have to cancel this discharge so the patient can stay longer. Okay, and the idea here, again, it's not the conflict in and of itself, it's how the conflict ended up being managed. And similarly, if this didn't go well, so let's say the nurse is either unable to resolve the conflict because they don't feel comfortable talking to the doctor, then as you can see, there would be a negative outcome from that conflict, right? So the patient maybe gets discharged and then has a poor outcome. And conflict may also continue to sort of burn with that physician, right? Because you weren't able to really have a proper communication or escalation when it comes to patient care. And so, to that point from the example, really what happens here in terms of healthcare, especially, is that if our conflicts are not properly managed, then there are harms that can happen, right? So we'll see things like lower performance in your team. People tend to have poor morale, which is, of course, not good. It makes you not want to work with people, makes you not want to come to work at all. And then a breakdown in teamwork as well. Otherwise, when this is actually managed quite well, we see things like a clarifying of roles. We're able to set boundaries with people, and then there's more of a balance of power within your team, okay, rather than, for example, the hierarchy that we sometimes see. And then ultimately, conflict can either divide or strengthen relationships depending on how it's handled. And again, if you want to think of a parallel, I would say this is true for relationships, right? So personal relationships. If you have a friend, for example, that you find you can't really have proper conflict resolution with, you maybe aren't going to have the strongest friendship in the end, right? So it makes sense. And it's the same thing for your colleagues at work. And so additionally, there is organizational conflict that can happen. So, for example, if you're working in a facility like a hospital, you have multiple departments, units that all kind of have their own resources and priorities. And so what you will find is that there is some competitiveness around resources. So, for example, staffing. And one area, always affects another area. So, for example, if there are challenges with beds, that will affect, whether or not the operating room can run, whether or not Emerge continues to be full and is housing admitted patients rather than seeing new ER patients, right? So instead of allowing people to come into the Emerge to be seen, it's just a full house. Okay, so this is a actually really, really big problem that's going on right now that continues to get worse and worse. It's been going on for a long time, but it's getting worse. And so these units may actually have conflicts with one another, okay? And I've seen this quite a bit, actually. And so, of course, this is more of a systems level thing, and we do think more about leadership and how we're going to manage this type of conflict. It's not necessarily personal either. I will not spend much time on this, but just so you guys have the definition. So when you're thinking about the word intrapersonal, and ensure that when you're looking at it on an exam that you are reading that part correctly, because sometimes I feel people are reading fast on tests. So just make sure you know what word it's asking you about. This is something that's happening within a person. So usually in this context, the nurse. So the nurse may be having some kind of internal struggle. I'm sure you guys know what that means. And then when you do your nursing practice, of course, this is going to come up in new situations where you're going to be reflecting a lot on these things, right? So you're going to see, for example, these systems issues, like I just mentioned, problems with not having beds, staffing issues, workload issues, and so forth. And so these are going to be some conflicts that you may find. And then moral distress is in regards to knowing that there's a right course of action, but then feeling unable to act due to the constraints. Okay, so you, again, usually thinking about in terms of a systems level, why can't I provide the level of care that I would like to provide to my patients? And that's usually related to staffing and workload. Okay, and so for this lesson, we will focus primarily on interpersonal conflict. And so that is conflict between people, so it could be nurses with patients, with families, or other healthcare professionals. And so some common sources might be that you're going to see, or sorry, that there's going to be an experience of incivility and perhaps aggression, and then communication breakdowns, as well as hierarchies and power dynamics. Okay, so again, this is all contributing to conflicts. And you can think of all the different people that you will have to interact with on your shift, right? So for example, when I worked in Emerge, it's not just families and patients, it's also paramedics, it's also police officers. You certainly can also come across conflicts with leadership in hospitals, and most likely you will. And so here is a clear example. So you have a doctor interrupts you as you are preparing pain medication for a 60-year-old patient. It is already 15 minutes late. The doctor says he needs you immediately in another patient's room to assist with a drainage and dressing change. Knowing that your patient will respond to prolonged pain with vomiting, you reply to the doctor that you will be available to help in 10 minutes after you help your patient with their pain meds. So you have effectively prioritized this. The doctor, already on his way to see his patient, whirls around, stating loudly, "When I say I need assistance, I mean now. I am a busy man in case you hadn't noticed." So thinking about this scenario and how you may respond, think about what might be an appropriate response here. So for this situation, this really is a high pressure interpersonal conflict. And then you can see that there's an important underlying tone of incivility, as well as an issue here of hierarchy, most likely. And so you, as the nurse, you know that you have to prioritize your immediate patient safety. So you know that your patient's pain and this risk of vomiting is actually your priority. So what this really requires from you is assertive communication. Okay. And ideally, maybe some closed loop direction as well. So you're not just explaining to the doctor. So you might say, I'm administering this overdue pain medication. This patient is at risk of vomiting, and then I will come and assist you immediately after. If this is urgent, please call another nurse now. Okay, so that gives them the option. You're not the only person. And then you would say probably something to, address the incivility. So maybe something along the lines of, "I'd appreciate if we keep communication respectful," because you also don't want to just let that part go. Okay. And then you've also identified clearly to them that you do have a priority, and you're not really apologizing for that, right? Because you do know what your patient requires. And so this slide really is just giving you some more background of, how does conflict happen in the first place? What's actually causing and contributing to this? So, for instance, we're not having the same expectations. We don't always understand one another's roles in healthcare, and then communication differences as well. And definitely issues of perceived threats, so maybe threats to safety or values. And then again, it's a high stress environment where there are hierarchies, so this does increase the likelihood that there will be potential conflict. If you work, really it's any healthcare area, but especially if you work in acute care and things are really, really fast paced, you'll find that people can become pretty easy to upset in some cases, right? Because again, their patients are maybe deteriorating, there's rapid decision making happening, and so for that, it is a high cognitive load, and of course an emotional stress response as well. Okay, so conflict is it's basically a perfect storm for a conflict to happen. Okay. And then so for disruptive behaviors, really what you're talking about here is these are behaviors that are actually disrupting our regular communication, effective communication and teamwork that we would normally expect and would like to achieve while we're on our shift. But these behaviors are going to interfere with safe and effective patient care. So there's effectively a breakdown in trust, collaboration, lack of psychological safety. And so examples that you have listed there, so bullying, incivility, lateral and horizontal violence, these are all things that you will, unfortunately, you will see when you go work in healthcare. And oftentimes these behaviors are actually normalized in our healthcare culture, but in fact, of course, they're not acceptable. Okay, so there's actually a lot of research on this topic, and yet it continues to be a big problem in our profession. And so the bottom line here, of course, is what you see in the right corner there is, as was mentioned in many of your presentations, when we have problems with communication, we are risking our patients' safety. Okay. And, people do go to work very unhappy. As you see the statistic there, 50% of nursing students experience bullying and harassment. There's a big problem with novice nurses leaving the profession within their first year of practice. It's a very high and alarming number. And even after a few years, of course, again, it's continues to be problematic. So hospitals have quite a challenge with retention for new nurses. Okay, so that's something for you guys to think about in terms of, how am I going to, well, for one, manage your expectations when you go into your first job, but also how am I going to deal with this stress and these conflicts? Okay, so it doesn't affect your decision whether or not to stay in the profession, for example. And so a consideration in regards to conflict management is also that this is a key component for your ability to communicate and collaborate, right? So you do need to know how to manage conflict because, again, it's an inherent part of our jobs. We work with people. And it can get messy with emotions and all of these things. Okay, so think of this as one of your core nursing skills. So when you're starting to think about how you're going to do conflict management with those that you work with, so the idea here is that you will identify the source. So checking your emotions, understanding, for example, was there a miscommunication? It's also very important to be assertive and goal focused. So, for example, you're not attacking the person, you're using facts and then aiming really for a win-win situation. Okay, and then we'll talk about some of these strategies that you can use and just making sure that you're not just trying to win the argument when you're in a situation with a team member. You actually have something more structured here. And so collaborating is actually where you want to go with this. This is what's known as your win-win, but there are other styles of ways of responding to conflict, essentially, right? So in some cases, people are avoiding conflict. And so, you may do this for various reasons, but at the end of the day, it's a lose-lose. Okay, so nothing will really actually get resolved. Okay, so the idea with what we're talking about today is that you're going to aim for collaborating. And so communication styles really do fall into one of these three. So either passive, assertive, or aggressive. Passive, you're basically avoiding needs, whereas aggressive, you're kind of trying to overpower others. And both of these tend to be ineffective, whereas assertive is nice and moderate in the middle, and that is your goal. So you want to stay clear and respectful and have a balanced communication, okay? But you're also not letting people like walk all over you, for example, okay? So when it comes to collaboration and managing conflict, this is your goal. And assertive communication really means being clear, direct, as well as taking responsibility for your actions. And it includes some of our key skills like saying no to people, asking for things, or addressing a need. and expressing your thoughts and feelings in an appropriate way. It also involves managing the interaction. So, knowing how to start, continue, and end a conversation. And this is important because, especially when you come into a conflict situation, you will have to decide, is this something that I'm going to now approach this person about and be able to do so? And then these are some other communication strategies that you will be able to use. So, for example, you need to pause and stay focused. And so, trying to respond in the moment and sticking to one issue at a time. That would make it so that, for example, it's not sort of spiraling and escalating. Ideally, you're going to be using I statements, and then if you can, try to use structured communication. Try not to blame people as well. And then ensure that your tone and body language are matching your message, right? So verbal and nonverbal. And so these are some ideas that should help with the communication. And then we'll talk about care and desk shortly. Okay, so the care is the first one. So this is a structured approach to address conflict clearly and professionally. And so the idea here is that you focus on a specific behavior and its impact, and then a clear request for change. And then so you'd follow up by evaluating if the behavior improves. And then for Desk, this is a communication tool. So it provides you with a clear step-by-step way to address unprofessional behavior. And so you're going to focus on the behavior as well as its impact and then the desired outcome. Again, trying to keep this objective. Don't use it to attack the person personally, and include a clear consequence to reinforce the accountability. And there's a video towards the end which makes this more clear. You can see how to use it. Okay, so we'll look at this example. This is an example from your Mallet and Young book. And so it's a student nurse case vignette, and so you are the student nurse. So you examine a crying child's inner ears and note that the tympanic membrane, so the eardrums, are red. You report to your clinical supervisor that the child may have an ear infection. The supervisor responds in the following way. Of course, they're red when the child is crying. Didn't you learn that in nursing school? I haven't got time to answer such basic questions. So think about this scenario and how would you respond to the clinical supervisor's feedback? And so your book talks about this in the context of recognizing that this is actually a put down and is an unprofessional behavior. Okay, so this comment actually should not be ignored and certainly should not be normalized. And so key ideas here of what should be done is that you should be responding to this as soon as possible. So this doesn't just become a worse and worse issue. It's going to create resentment, for example. It's going to destroy the individual student nurse's confidence. It's good to, of course, take a brief pause. So, for example, if you need time to collect yourself because you're feeling very stressed and anxious in that moment, it's good to try to calm yourself, but don't wait too long to just leave the situation too long. And then to address the specific behavior and its impact on you. Okay, and again, not attacking the person's character. So you will not say to the clinical supervisor that you don't like them or something like that. Just address the behavior that's in question. Try to remain calm, and your response should also demonstrate calmness as well as assertiveness. Okay. One of the key things, I think I mentioned it last week too, is to also have a prepared or rehearsed sort of phrase or line in your head so that when things like this happen, which they will, you have something that you can actually say right off the bat. And I don't mean anything like sassy, but just something professional that you won't just stand there, deer in headlights. How do I respond to this person? Okay, so it's good to have that already prepared. And so for this example, what you can do is apply this desk communication tool. So first of all, you would, like I said, make sure that you're actually calm enough to have this conversation. Think about that cognitive rehearsal, what you maybe already had planned in mind about how you would immediately react. And then so for the D, you have described the behavior. So this is what the person is saying. When I examined the child's ears, I noticed the tympanic membranes were red and reported it because I wanted to ensure accurate assessment. Okay, so you've effectively given a good description of that behavior. And then for E, explain the effect of the behavior. So they're saying, I felt dismissed and embarrassed when my question was called basic and when I was told you didn't have time to answer. Okay, so and then notice that they're using the I statement here. So I felt dismissed. And then so S is stating the desired outcome. So I would appreciate if you could provide clarification or guidance when I'm uncertain so I can learn and provide safe care. And then C is the final consequence. So the idea here is that there's some shared ultimate goal. So this will help me build confidence, improve my clinical judgment, and ensure the child receives appropriate care. And in some cases, you might even say something like, how you would like for them to actually address a similar situation. You might say something, for example, like, if you don't mind to actually pull me aside and tell me this in private, one to one, rather than making me feel embarrassed or something like that. So it depends on the situation, but this is actually a good example. And so, responding to criticism is important. I did kind of touch on this last week as well. So, your criticism can be constructive. So, in the sense that, you're getting feedback, it is important because it's going to support your learning. But then sometimes it can actually be destructive. And so, for example, what you just saw, the put downs, making people feel embarrassed in a lot of ways, also even just not wanting to, for example, come to clinical because you just feel so scared to be put down. And it does happen, unfortunately. And then, of course, this is not good for learning, okay? And so we want to focus on this constructive criticism, ideally. But you guys also need to know how will you respond if you're not getting that, if you're getting the destructive kind. And then this is essentially the same point. Again, it's from the book. So what you're seeing here is the constructive version, and it's actually going to support the learning. Okay, so the response might be when a child is crying, the drums often swell and redden. So there's a teaching point there. And how about checking again when the child is calm? Okay, so there's no put down remark at all. And it's focused on learning and improving assessment. Okay, and not making it a personal attack on that individual. And you can use DESCA here as well for your constructive criticism. Okay. This image is actually just from your Mallet and Young book and just kind of gives you a nice point about reducing interpersonal conflict in general. So, for example, moving from communication in silos to a more open and team-centered collaboration. So we're having common language, for example, trying not to be so hierarchical. So thinking about dominating others, rather we're thinking about things like mutual respect, expertise, and so forth. Okay, things that you guys should know a lot about now. So there's actually a video here. It's a good example of nurse conflict. So maybe just go ahead and watch this, and then you'll have a little bit better of an idea of what we're talking about in terms of how you would use the DESCA, for example. Okay. And then we'll talk a little bit more about workplace bullying and horizontal violence, and then client nurse abuse. Okay, and so workplace violence is actually, unfortunately, very common in healthcare. It affects staff as well as students. And so healthcare workers actually experience higher rates of violence than many other professions, and are at particularly high risk, especially from patients and their families. Okay, so unfortunately, it's not a rare thing. Our jobs are actually quite dangerous. And so violence includes the use or threat of physical force that can cause harm, and it can be physical, verbal, or nonverbal behaviors perceived as threatening. And in our settings, violence most often comes from patients or their families. And workplace violence also includes harassment and bullying, both of which involve unwelcome and persistent behavior. With harassment, what you'll see are things like offensive comments or jokes, behaviors that are demeaning or intimidating to an individual, as well as bullying. Okay, so this is basically repeated behavior that harms others. Okay, so things like rumors and intimidation. And again, these things are actually quite common in healthcare. And so the way that workplace violence is classified, it is by who the perpetrator is. So that could be external versus internal. And so for type 2, what you have highlighted there, client, basically it's your patient, like I said, is the most common in healthcare. And then your type 3 is the worker to worker. And so this does also include the bullying and horizontal and vertical violence. Okay, so that can be also people in leadership roles as well. So, thinking about the fact that violence is an inherent part of our work and the environment that we work in, it's important for you guys to have an understanding of how you will manage, for example, an angry patient. So there's lots of tips here. So recognizing and assessing levels of anger early to prevent escalation, and supporting the person to also express their anger safely and appropriately. Because, I mean, people are going to be angry. That's not something that you can really control in this setting. And then using communication strategies to diffuse and de escalate the situation. So, wherever you go to work, also, they usually can. And do provide you some training in regards to this because it's such a huge problem. It's actually a big liability for the hospital because people are getting injured all the time. And so they do take it seriously. And so a key component of this is to recognize signs of anger or hostility. And so verbal and nonverbal cues of anger. So you would know, based on their tone, perhaps the way that they're speaking, maybe sarcastically. There's some tension. Usually people start tightening their fists. So there is some visibility that they're angry. And then understanding that typically there's a fear or frustration or a loss of control that's underneath the surface of that anger. And if you have early recognition, helps you intervene and prevent escalation. Okay, so you have some examples there. So clenching of fists, grimacing, and so forth. So, if you are picking up on these, then this is something that you can't just ignore. I will not read this because it's actually just in your book, but these are some examples of behaviors that can either trigger or escalate someone's anger to be worse. And I've seen this happen many, many times. Some people don't think about whether or not they're escalating somebody. And so maybe they're not thinking consciously about this, or maybe they don't know about it. I don't know. But I have seen it many times where the opposite effect is happening. So just try to understand that there's certain things that you can do that will just make it worse. So for example, many people commonly know that if you tell an angry person to calm down, people don't like that. It usually doesn't make them more calm, it makes them worse. And then these are also some key points. So for example, you need to start with your own self-awareness. And your own reactions as well. Like I said, with people that I have seen in these types of scenarios, sometimes it is the way also that they're approaching the patient or client, and that's causing this sort of um, worsening reaction from the patient. Also consider that the client has a specific context of illness, potentially loss of control, and then so that is also going to increase their anger. So, for example, people who are waiting a really long time in the emergency department tend to start getting really angry. It's really hard to even be not understanding about that because nobody likes waiting for a long, long time, especially when you're not feeling well. So you have to take it also into consideration. And then also trying to use a structured approach to respond professionally. And so ensure that you do keep your own safety as a priority. So we have this idea that we have to have a situational awareness, so your environment, and knowing, is this situation sort of getting a little bit too out of hand for just me to deal with, for example, and then that recognition of those early signs, right? If that person is tightening up their fists and they look like they're ready to punch somebody, you should really not be in the room with that person, right? So ensure that you are taking the necessary precautions. Press your panic button. Most places have them, as far as I know. Everywhere that I've worked has had them. I'm not sure what your security situation is in LTC. I've heard it's not the best, but definitely know what those buttons do and who to call in an emergency. Okay, so you may need to call a code white, for example. And just remember that it's not worth it for you to get injured. Okay, your no job is worth it. So these are some ways that you can, again, try to think about how you will manage the situation. So you should know, for example, on the exam, what you would actually do if there was a patient in front of you that's escalating. And I do have a video coming up. I can't play it because I don't think it will work as I'm recording here, but please do watch it. It's a really good example. And so thinking, for example, about how close you are to the patient. If you, for example, come too close, for many individuals, especially when they're starting to get agitated and they might feel threatened, if you come too close, that might be the thing that triggers them to decide to hit you. And then so your verbal de-escalation as well. So thinking about, how are you listening to what the person is saying, or are you talking over them? Are you um, you know, raising your voice because they're raising their voice? So you have to think about all the different verbal and nonverbal key points here about how you're interacting with that person. Because from what I've seen actually is there are some people that are really, really good with de-escalation. Some people are okay, some people are not very good at it at all. And so ideally you would get to a point where you do have the ability to de-escalate somebody, especially if it's in the early stages, and you can talk somebody down from becoming a code white, basically. And then this is just continues to be an extension of what I was just saying. So, for example, that slide mentions only 60% eye contact. So again, you don't want to be staring at the person so hard that they are feeling uncomfortable. Okay, so this is why it's also important to practice your interviewing skills, to practice all of these communication skills, because then when you're in a situation that's extremely high stress, like a crisis situation, when you don't know when it's going to happen, then you will know how to actually approach the situation. What I what I have also found is that mental health nurses they are really good at this type of thing. They have a lot of training in it and a lot of experience, and they're very effective. One of my friends works for public health, and she was an MCIT nurse for a long time. I think she said they're cutting the positions now. Um, and so they go with police and they do calls with them to do de-escalation. So there are jobs for people that really like this kind of stuff. And so this is the video. So actually just watch this video when you have a moment. It's very good. And it gives you a really good idea of what good de-escalation looks like and what not so good de-escalation looks like. Because you can see that when it's not done properly, it actually makes the situation worse and much more dangerous. Okay, so like I said, just make sure you watch the video, and then I have some questions here to wrap up. So the first question is, which of the following nonverbal behaviors sends a positive calming message toward an angry patient? And so the answer to this question is B, speaking in a calm, low-pitched voice. So question number 2, which of the following strategies should be used when dealing with interprofessional conflict? And it is a select all that apply. So the answers are A, gain an understanding of your own feelings. B, use assertive communication. D, express how the situation makes you feel. And then E, mutual resolution resulting in a win-win outcome. Okay, practice question number 3. You are caring for an elderly client who curses and yells at the nursing staff, often refusing to take medications. Which of the following statements made by the nurse demonstrates assertive communication? Okay, so the answer to this one is C. I want to help you sort this out, but if you continue to curse at me and raise your voice, I'm going to have to leave. And so this one might be more tricky, but the idea here is that you're using the I statement, and then you're also setting the boundary for this person, okay, because they have escalated. And so, for example, B sounds potentially plausible, but it's not really going to be super effective. It's not assertive enough, that statement. Plus, there's no I statement in that one. All right, so that's all I have for you guys. Please make sure to go back and watch those videos, and there's a few in the addendum as well, readings and videos that are actually very interesting and important. And then we can take up questions in class if there's anything that was unclear from the last 2 weeks where we just did the recordings. All right, thanks a lot, and I will see you guys next week.